Board.
Welcome, everyone. We're excited to jump into this conversation today. As someone who's a psychiatrist and thinks about how we think and our psychology, and as someone who creates content that reaches millions of people, I'm always looking at different ways to explain complex medical things to the lay public, right? So I'm excited to have this panel of professionals. We have just about every sector of healthcare represented on this stage, and we're going to talk about how certain policy changes impact you, right? Because a lot of times we don't fully understand what these headlines mean, and this is a way to break it down so that you can feel empowered, so that you know how to take actions that are the best choices for you. So I'm going to start with the facts. I have Dr. Mitchell here, who is a leader of a major hospital health system. And a lot of times we see a lot of numbers, we don't understand how that impacts us. So please, tell us about some of the important statistics that we should all know about.
Well, thank you. It's great to be here at Essence in the Global Economic Forum once again to talk about the state of healthcare. I'm a forensic pathologist, and you may not know what a forensic pathologist does. We do autopsies. We look at death and understand life and understand health through the lens of the autopsy. I am now a hospital president of Howard University Hospital there in Washington, D.C. Thanks for the shout out, that one person. And so one of the things that we have to realize is that we measure our ability to move the pendulum on healthcare through fatality statistics. Unfortunately, mortality statistics play a part. And so when we talk about the number one killers of our community, hypertension and cardiovascular disease is the number one killer of both black men and black women. But what's also important is that adolescent men and adolescent children, and children in general, the number one cause of death is homicide. So you can't even talk about healthcare without talk about violence. But let me give you a couple more statistics. Of heart disease, black men are 30% more likely to die from heart disease than their white counterpart. Black women are 60% more likely to die from cardiovascular disease than their white counterpart. A lot of people don't talk about black women and cardiovascular disease, but that's extremely important. When we're talking about breast cancer, our black women are 40% more likely to die from breast cancer than white women. Prostate cancer, black men are 2 times more likely to die from prostate cancer than our white counterpart. And so these are the striking statistics and really a baseline of this climb that we have to do. And we need to understand that these particular statistics are things that we can change.
It's so important to understand how the numbers impact us, because then it becomes stories versus just numbers that we don't understand. Dr. Janae, tell us about how the changes in healthcare policy impact us. You and I were talking earlier about how in the car your Uber driver was saying, wow, like my Medicaid is cut off. What do I do next? So as someone who is a leader in policy, what should we know?
Yeah, thank you. It's really just an honor to be on this panel and here at Essence. I'm a practicing urban ER doctor. I've worked in corporate healthcare. I've led state and local public health, Medicaid programs, and in the nonprofit space as well. And I'll tell you, I am very concerned. I'm very concerned for my patients. I'm concerned for the organizations that support the patients and their communities that I take care of. And quite frankly, I'm very concerned for my own family. And let me tell you why. We currently have, really, I would say, a perfect storm of policies that are impacting communities across the entire country. So I'll talk about some of them. I could go on and take up all the time, but I won't do that. But I'll just talk about a little bit, right? So let's talk about Medicaid. Medicaid is the insurance for about 70 million, over 70 million people across this country. 4 in 10 children have Medicaid as their insurance. 6 out of every 10 people living in a nursing home. About 1 out of every 5 people on Medicaid are African American. And so there was a bill that was just passed and is now law in the past week, where it's estimated that about 17 million people will lose their Medicaid insurance. So what does that mean? Again, I'm an ER doctor. That means that people are going to forego, not get the preventive services that they need. They're not going to be going to their primary care doctor. They're not going to be getting that surgery that they needed, right? That means when they do come into the ER, which is, by law, we see everyone who comes through our doors, they are going to be sicker, and they are not going to be able to have a bed for me to put them in, and our ERs are going to be busier, not just for people with Medicaid, but for everyone who's coming into the ER. I talked about nursing homes. Medicaid is a primary payer of long-term care services in this country. So if you, and all of us, if you live long enough, you will end up having some type of disability. You will need help. You might need a nursing home. You might need services so that you can stay in your home and live at home as long as possible. Unfortunately, with the Medicaid cuts, people are not going to be able to have those services. I don't know of anybody who can pay for all of that out of pocket, right? We also know the hospitals and the clinics that serve people, not just with Medicaid or who do not have insurance, will be impacted, and many of them actually will close. I also work in public health. Your health department is the one that is making sure your food is safe to eat. It's making sure pools are safe to swim in. It's providing those preventive services in communities to prevent chronic diseases, to prevent injuries like gun violence, drownings, falls in the elderly. I could go on and on. Those services are either being eliminated or cut significantly. So I'm very concerned. I'm concerned that the system that we are all used to working in and living in is being dismantled. It is going to significantly impact every single person in this country. I'm concerned not only for Black people, I'm concerned for people with disabilities, I'm concerned for the elderly, I'm concerned for the poor, I'm concerned for people living in rural communities. I could go on, but we are really living in very serious times right now, and I think it's very important that people understand that and pay attention.
It's really helpful to understand how many different people across development are impacted: children, elders, adults, folks with disabilities. And what you said about preventative care, I don't think many people think about these services as preventing, healthcare outcomes that are negative. And so that leads me to you, Dr. Danielle. You work with a large organization that supports healthcare professionals, and we're the ones on the front line. How are these policy changes going to impact healthcare professionals?
Yes, and I have to give a shout out to Maryland. My governor's here, my first lady's here, my mayor's here. I'm a resident of Baltimore, so I'm really excited to be here. And Dr. Janae, thanks for the setup, because for me, I have the privilege of having 3 hats. I'm an academician, I'm an acute care nurse practitioner, and I'm a leader of an organization that focuses on the diversity and development of nurses of color that are in leadership spaces. So from my academician hat, we're seeing the disruption of an already fractured pipeline of getting the diverse talent into the schoolhouses. We're also seeing the decreases in funding and scholarship and support that eliminates those financial barriers for folks to have access to quality higher education. And then that just spirals into the shortages of having faculty, and let alone faculty of color, that represent the diversity that we need to keep and retain the talent within the schoolhouses. And then you add in the lack of the gutting of the research funds so that we are able to build up the body of research to inform the evidence for us to be able to teach the next generation. And so when I think about from my acute care nurse practitioner hat, I work in the ICUs, so I see the fallout from all the failures of preventative health care, from folks not getting the adequate primary health care or losing access to safety net hospitals that are stationed in urban, city, rural areas. And so it's increasing this time of patients actually going to get access to health care. And then with this new legislation, it's going to be closing a lot of hospital doors. So there's going to be tons of hospital deserts. And so by the time they come to my doorstep in the ICUs, that roadway or that runway to recovery is drastically shortened because they hadn't gotten that immediate acute care to help them get a fighting chance to be able to move through that system. And then I think about my colleagues. COVID already amplified an already burnt out, morally injured healthcare profession. And so you put us in an already fractured healthcare system, and then we put in these policies that continue to fracture and break the system on providers that are already feeling morally distressed because we can't take care of our patients according to the evidence, according to the latest best practices, because we don't have access to the resources. And then we're seeing these patients with these multiple complex comorbid conditions. So we feel hopeless and helpless because we have the knowledge, we have the skill and expertise to take care of the communities and the people, but we have insurance companies dictating, we have the current laws dictating on how we actually implement that care. And then from my hat leading a nonprofit called DMPs of Color, I'm the president, founder, and CEO. And so this aspect, my hat focuses on those that have gone through the education, that are currently practicing, but because they have their DMP, which is a doctorate in nursing practice, it affords them a certain level of power and influence and education to be at these decision-making tables where they're calling the shots, where they're making the budgets. But now they're starting to have to make these difficult decisions of layoffs. How are we going to get funding to do research for our providers to practice at the evidence-based levels? And so it's really a profound hit on the ecosystem of healthcare that we know of today. So seeing it from my three hats, it's going to be pretty profound impact.
It is, and I'm glad that you brought up research because we know these policy changes are impacting research funding. And research is a way that many people access care. You know, it's not just being a guinea pig. Some of these research protocols are actually a primary source of treatment. And so I'm excited to talk to you, Dr. Lauren, about how research can bridge the gap, especially privately funded research, when healthcare policies may not, be able to provide the care that we need.
Yeah, absolutely, and it's a pleasure to be here. Thank you for having me. It's interesting, as I was listening to everyone's response, I was thinking about how all of these areas apply to drug development, and I don't think everyone sees the connection there so readily. So what Dr. Roger was talking about around all the statistics around, the inequities within certain disease areas, that's certainly present in many of the disease areas we study widely across the industry. And Dr. Jonet was talking about cuts to Medicaid and the implications for that, right? For preventative services, for even testing, for the ability to us to even know the incidence and prevalence of diseases, the implications of the cuts there for us in drug development, and not having a lens now into really important data that we need to make critical decisions about where diseases are, where they cluster, who is most impacted by them, all the way down to workforce challenges, right? And not realizing that there's an entire ecosystem of a healthcare workforce behind clinical trials, behind drug development, that we need research nurses and clinical research coordinators, and the implications for that, even for us now in drug development. And so when we're at a juncture right now where only 8% of patients that participate in clinical trials are African American, what does it mean to have all these additional roadblocks now in front of trying to make a difference there? It's quite a few challenges that we certainly have to work really hard to overcome. We're working on that in a couple of ways, and being here is one way. I think, sharing information in places that are community-centric, that are culturally relevant, and that presents information in a very digestible way has to be a way of life, I feel like, for us moving forward. If we're talking about the state of Black health, I think we have to continue to be in spaces it's now more than ever. We have to be in spaces like this. We have to share information in ways that it's easy to understand, because there's such a significant effort to make sure people don't have information, the right information that they need. And so, I think all of those ways are ways that we're thinking about, and much more.
That was a very nice way of tying all of these different sectors together, because you're right, they are very connected. And it's not just the policy that's changing, technology is changing. Yes. We all hear the word AI, and there are emerging tech that are creating different changes in healthcare and the way it's delivered, the way that data is interpreted. And so I'm going to go back to you, Dr. Mitchell, because you see healthcare from this umbrella of different hospital systems. What are ways that AI and emerging tech are impacting healthcare delivery? And how do we learn about this so that our community is not left out of the conversation?
Yeah, I'm glad that we're talking about solutions, right? Because there's a lot of obstacles right now that we're facing, and it can feel daunting. It's Sunday, so, I got to bring up a scripture. In James 1 and 2, it talks about count it pure joy when you face obstacles of many kinds because it produces perseverance, right? And so this is the climate we're in, is that perseverance. I'm the incoming president of the National Medical Association, the oldest and largest group of black physicians in the country, 1895. And some of the areas that we're talking about are artificial intelligence and economics, and making sure that we bring and make sure artificial intelligence is part of healthcare delivery no matter where you are. So some of you right now have your phones and you're getting your labs on your phones, right? That's part of the artificial intelligence. I'm sitting next to the doc and I forgot my wearable. She has her Aura ring on. We don't get any money from Aura, so maybe they should give us some dollars. But everybody should, you might have a smartwatch. Imagine if we were able to get wearables on everybody, right? Where your status of your blood pressure, your sleep, your numbers are at your fingertips, because the things that we monitor are the things that we change. At the end of the day, we know that prevention is really the art of medicine. In Western medicine, a lot of the times it's individuals that come in after something has gone so bad that now you need a surgery. And yes, that's a very important of healthcare delivery. But what's the most important is whether or not we can prevent it. So one of the things that we want to work on at the National Medical Association is to make sure that we have ambient AI technology for all of our providers. And making sure that our providers can carry on their phone and place their phone down and have a conversation with their patient, and that conversation shows itself in the medical record as a full note. So that way that physician can spend more than 12 minutes with you. On average, the physician is spending anywhere from 10 to 12 minutes, but maybe they need to spend 15 minutes with you. Depending on what you have and what you're dealing with, maybe 20 minutes. So we want to make it easy for the physician to spend that time with you. These are the types of things that we need to be leaning into. Getting your wearables, making sure that you have access to preventative constructs, and leaning into the AI space. If you're entrepreneurs, leaning into the health AI space is going to be extremely important as we move into the next phase of this new healthcare delivery system that we have to create for ourselves.
And if I can like add on to what you were saying, so much has been said there. The way that AI is being leveraged even in drug development is so significant. To even like wearables, like there are now clinical trials in some ways that are monitoring using wearables. And so if our community doesn't have access even to that, doesn't understand the value of that or how to even use it, it's not easy to set up a Fitbit on your phone. Like everyone doesn't have a smartphone to do that. Everyone doesn't have the data, the Wi-Fi. There are large swaths of this country that still does not have internet access. So it's a greater hurdle to have to overcome, right? As AI and like health technology continue to be like more deeply woven into the tapestry of healthcare.
And I'll just kind of jump in as well. I think it's also important, in the spaces that I'm in, particularly with African Americans, there's a lot of mistrust of AI. People don't want AI being involved. It's like the boogeyman. And what I say is, to your point, we need to lean in. AI is here. It's already being used. What is AI? All AI is a bunch of data. It's put into a computer system. That computer system, if you will, I'm keeping it really simple here. That system has been told how to interpret data, how to analyze data. And so it's basically just giving some rules. So they take your data, they apply the rules to it, and they spit out whatever it is, whether it's a prediction, analysis, what words to say. That's what AI is, and it's already here. As an ER doctor, it's already helping me think about diagnoses for my patients. I went to the doctor recently, and the doctor was like, hey, Jonae, can we use this app? I was like, absolutely, please, because I would love for you to just like make eye contact with me, right, when I'm in the doctor's office instead of looking at your computer. So AI is already here. It's being used in radiology to improve diagnostics, being able to diagnose breast cancer. So AI is here. I would encourage people to lean into it, learn about it. You don't have to develop a new technology. We can talk about Oura rings. Just lean into it, understand it, so that when people are making policies about how to use AI, there's people with different experiences who are at the table to develop those policies. Because the challenge is, and I'll stop after this, the challenge is we know that there's already a lot of bias and the data is imperfect, and often we are not included in those data, so bias can be spit out, but there's also a lot of opportunity as we've been talking about here.
And that's something I'm glad you brought up, the lack of trust, because a lot of people think that AI will take away jobs from healthcare professionals. And so, Dr. Danielle, if you could just illuminate us there, is AI going to take jobs away? Is it going to help us? Clarify that question for us.
Well, AI is not going to take away the value that we bring being in the healthcare space of centering humanity. And so one of the things that I charge us to do is, as we're leaning in, we also should be leading and developing the technologies, because I know, speaking from the nursing perspective, we haven't been so, what I've observed, we haven't been kind of leading in this space. And so I think that really charging us to focus in on how we can be part of the development, leaning in on learning about the new technology so that we can use it to help supplement the work, but not supplement us in the care and the health of people.
And I'm so glad that you brought up how AI is changing research. As someone who runs a clinical research lab, I work with AI all the time with my patients who participate in studies, and it is a game changer. You can collect so much information from your individual health that helps your healthcare professional to tailor the treatment to you. We only have a couple of minutes left, so I just want to ask each of you, one last thing. If you could just leave us with one note about the future of health for Black America, what would it be? We'll start with you, Dr. Danielle.
No one's coming to save us but us. And so for me, I want to charge us as panelists, I want to charge you to find ways to leverage your collective knowledge, power, and influence in your communities to identify gaps and opportunities for you to close some of those gaps. And I'm also charging us here in this forum to really think about creative and innovative ways to invest in community from the education perspective, from the advocacy perspective, and from a community perspective.
I would say, from my perspective, knowledge is power. And that's why there's a concerted effort to keep us from having knowledge about certain things. So knowledge is power. Pursue the opportunity to learn. I think it's on us to create opportunities to share information with you. But knowledge is power, and our people have been here before. We have been in worse predicaments. And I know that we are resilient and we will overcome.
Yes, we will.
I would leave you with that health is in everything. W.E.B. Du Bois talks about the 5 policy areas: education, economics, housing, healthcare, and criminal justice. And if he was here today, he would say environmental justice as well. So those 6 areas of access, advocacy, policy, preparation, leaning in, giving all of your talents, all of your time into one of those areas that you feel best about, and understanding that access to those things will decrease the burden of disease and injury in our communities if we're engaging in those 6 areas. So no matter what it is, engage. I love that nobody's coming, and if they are coming, they're coming to harm us. And so we have to really lean into our ability to do what we need to do. I'm calling this era the new Reconstruction era. And if you know the Reconstruction period, you know that that's when we were at our best.
Yeah, I would just add, be knowledgeable, and quite frankly, on a very basic personal level, prepare yourself. No one is coming. Get your finances in order. Whatever you can do that's in your power to stay healthy, get your preventive care services. Know that things are going to be hard. Things are going to be getting really challenging very quickly. Take care of yourself. Again, I know this is very individualistic, but that is what these systems are set up, is for us to take care of ourselves, to take care of our families, and to take care of our communities. So lean into that. That is very serious right now.
Well, I just want to say thank you to our panelists, and the information here was very powerful. So everyone, please give them a round of applause. Thank you for joining us.
Who they want?